Welcome to the Talking HealthTech podcast. My name is Peter Birch. Today on the show, I'm joined by Patrick Hart from Concentric Health, and we're going to talk about consent in healthcare, digital consent, shared decision-making, modernising healthcare, and how to improve the patient experience focused around the consent process. G'day, Patrick. How are you going?
Very well. Thank you very much for having me on, Peter. Looking forward to this.
It's great to have you on the show. Keen to dive into a topic that everyone knows is important in healthcare, and it's kind of almost seen, I guess, like a ticker box type process. To be able to kind of deep dive into it a little bit more about what consent is and why it's important, and also what Concentric do in relation to that. But firstly, would you be able to introduce yourself? Tell us a bit more about you and what you do and how that ties in.
Cool. Thank you very much. So I'm Patrick Hart. I'm a medical doctor by background, trained in the UK, and I have been in Australia for coming up to about a year by now. So I have been with the Concentric team for the past 3 years. Started in a broad ops role, recently been focusing on the product side, and now leading on our international rollout. So Concentric is a digital consent to treatment application. We have a product used in place of the traditional paper consent form, with the primary focus of helping patients make better decisions in healthcare, better informed decisions, and ensuring that decisions in healthcare are shared between the clinician and the patient.
Got you. Keen to dive in and learn a little bit more about what that looks like. But when I think consent, I think of a form, and I'm usually given a clipboard in a lot of my clinics that I'm visiting still as a consumer. It's kind of, you say yes, and there's a lot of words above it, and you kind of feel like, well, I've got to say yes, otherwise, this is not what we don't proceed. But tell me a little bit more about what consent looks like in healthcare today, or if not for solutions we're going to talk about.
Consent is a process. In lots of conversations, consent is spoken about, as you just alluded to, as this form that people sign, in many cases, sadly, on the day of their treatment or their investigation, when they've kind of already made the decision about having the treatment. They're often given this piece of paper with the name of the treatment, a little bit about what they're hoping to do, and then a list of risks. And then people add this signature at the bottom, and often there isn't time for the patient to actually think about what that means, consider it themselves, have a discussion with relatives. And so consent, really, informed consent is the kind of full term, but it's allowing patients to make voluntary decisions, having received clear and relevant information about their treatment, outlining intended benefits, the potential risks of the treatment, and using all of that info to make a decision about whether to proceed with a treatment or an investigation. So in many cases, as we kind of said, this is a piece of paper and it's given to people. It's often a rushed conversation and then a signature gained from the patient. If there are any doctors listening to this or other kind of clinicians, you may well remember having been involved in the consent process, where you talk about consenting a patient, or it's someone's job to consent the patient. Definitely not a term that we like to use, because it implies this act of getting something out of the patient, or kind of doing something to the patient, when actually this should be something that's really patient-centered, and allowing them to make the decision for themselves, rather than a doctor or another clinician going to the patient to quote-unquote consent the patient, which leads into that feeling of this just being a tick box form exercise.
It is interesting to think about, that framing of consent being a thing you get out of a patient, or is done, like it's a process, or a form, and that's physically how it exists. But to think of consent by way of a conversation or an information session. Tell us a little bit more about how Concentric thinks about consent.
Yes, so we've really tried to move away from that concept of this being a last step before treatment, but actually being really integral to the entire treatment decision, and the entire treatment process. One of the problems with the consent process is that on the day thing of that being done at the time, but also because traditionally this consent process is done on paper. You could get 10 clinicians into a room and ask them to create consent information for the same patient, 10 clinicians, one patient. They may all give the patient very different information. So there's a lot of variety in terms of the information that's provided. So the approach that we have taken is kind of twofold. One is to recognize that there is still a need for the patient to receive and acknowledge their treatment information in terms of acknowledging the benefits and the risks and adding a signature. But actually, there's another element to this, which is giving them information as well and ensuring that patients receive standardized information that's then personalized to them. So how Concentric actually works is it's an application that is template based. So as a clinician, you specify what the treatment is that you're proposing for the patient, and you start from a template that contains the information that you're likely to need to provide to this patient for that specific surgery or other treatment. And then with this patient in mind, you can then personalize it specifically to them. So it means that we get standardization of information across the board, but the patients are still continuing to receive information that's relevant for them. We know that the use of paper consent or the paper form as part of the consent process leads to patients not feeling included in the treatment decision, of it being that kind of tick box process. We know that about a quarter of patients experience gold standard shared decision making in that scenario. So shared decision making being the feeling of the patient making a decision in tandem with the clinician, because patient the expert in themselves, clinicians the experts in the treatment options, and between them they should work together to assess all the treatment options and pick the one that's best for the patient, not this being a kind of didactic paternalistic view where the clinician says you have a sore knee, you should have a knee replacement, when actually there are tens of different treatment options for all patients, and each patient needs to make their own process. So that's a quarter of patients, gold standard whenever paper is used. We've seen that digital consent, of which Concentric is one such solution, when digital is used, that proportion increases to nearly three quarters. So to 72% of patients experiencing gold standard shared decision making when Concentric is used in place of paper consent. So that's 72 versus 28%. So quite a big jump. There are lots of reasons why that may be the case, but one such reason is that breadth of information, that kind of wealth of information that's provided to the patient from that standardized template, which then personalized to them so that the patient receives kind of much more information than they would in that traditional process.
Yeah, that's interesting. I want to dive into that a bit, because if I think about if I was a clinic owner or a hospital decision maker, running a clinical care pathway of some kind where consent is required, and it's a requirement, and I guess the base minimum requirement is here's the bit of paper or the PDF of the patient that's consented to the thing, and we're going to now focus on the treatment. But it's kind of what you're suggesting around that gold standard, that the basically 1/4 to 3/4 is that if nearly 3/4 are getting the gold standard level of shared decision making, not just like customer service, because there's one thing to just say, oh, like let's do a really comprehensive consent process so it feels nice for a patient, which doesn't sound like what you're saying, and it's there'd be a lot of people like, well, it's let's do the minimum requirement because there's other areas we need to focus on and all of that. But it's almost like you're saying, by having that more kind of two-way and open early consent process, it's incorporating more to the shared decision making, which then can directly impact the treatment, the types of treatment that a patient will receive. Am I kind of on the right track there?
Yeah, totally. So I'm going to pick up on the first part of what you said after, but just to talk about the kind of final thing you said there. So shared decision making is a expanding area of research within healthcare. It's something that I kind of nerd out a little bit in this and find it really interesting in terms of how patient experience of the decision making process impacts the types of decisions that they make. And so generally, a higher rate of gold standard shared decision making, so patients feeling more involved in their care decisions, they're actually likely to make more conservative treatment decisions. So that means people not going for these, large surgeries when otherwise they may have done so if they felt that this was something that was being kind of prescribed to them by their
Mm.
clinician rather than it being something that the two of them were coming to the decision about together. So you were talking about the experience if you were a clinic owner or if you were a clinician, like how this is perceived to the patient.
Mm.
So to paint the picture for you, in virtually all areas of healthcare now, things are moving, processes are moving from analog to digital. So we're taking things away from being on bits of paper and bringing it all together into a streamlined digital process in lots and lots. And this is the case in the UK and in Australia. So obviously Concentric Health, UK company, lots of experience there, and now come across to Australia and New Zealand to grow the use of the product here. And consent is one of the last processes within hospitals, within clinics, and within all healthcare organizations to be digitized. It is often, in some cases, actually the final piece of paper that remains in the clinical workflow. And there are lots of reasons for that, not least of which is the complexity that goes with the consent process in terms of it being requiring patient interaction. So if we think about in a hospital setting, virtually all of the interaction with the electronic health record or the electronic medical record is done by the clinician. The patient doesn't really directly touch it. The consent process, because there's that element of the patient's signature, it adds an element where the patient needs to have some kind of direct input. So that's kind of one of the reasons. But it's really complex, and it's therefore one of the last pieces of paper. So if you're a patient, you still see that there is a paper process involved in your treatment pathway, which to me, if I was a patient, I wouldn't really get an impression of a streamlined, slick healthcare organization or clinic or whatever it is if I'm still being handed pieces of paper as part of my treatment.
Mm.
If everything is digital, I think, wow, they're really switched on, everything's linked up, and it's a much more kind of streamlined process. So that's just to go back to that.
Yeah, 100%. You to pull on that thread around, yes, it's a complicated process, probably the last one that stays as a paper form because of all those the nuances and the requirements around consent. So then from Concentric's point of view, to build a scalable platform in order to enable that process, how do you go about giving those clinics the rigor of a system, but also the fact that every hospital, every clinic is going to have a different requirement and probably system connecting all those kind of moving parts?
Yeah, absolutely. And that's one of the things that makes this super complex, which is why it's kind of fun to be involved in, because there's lots going on. So to think about this from a clinical side before we look at the kind of technical side. So on the clinical side, for a hospital or an organization to use a product like Concentric, it needs to fit all of their clinical pathways. It needs to fit for if we're thinking about large secondary, tertiary care hospitals, it needs to cover all specialties, it needs to cover all treatment pathways, it needs to cover consent for treatment investigation, but also things like genetic testing, for data sharing. So it's kind of all encompassing. So we have, over the last 5-6 years, built out Concentric to cover all medical surgical specialties, to have templates covering over 2.5, nearly 3,000 by now, and different treatment scenarios. So very kind of broad ranging in terms of the clinical side. So that's one thing, and that's one part of what makes this a challenging space to be in terms of the complexity of the process. The other side is then, as you say, integrating this into not only the technical side, but also just the clinical workflows. So the best consent process is for as much of that process to take place in advance of the day of surgery as possible. So what we don't want is patients to be showing up for their colonoscopy, their knee replacement, their cataract surgery, whatever it is, having not really considered what their treatment options are, and as we talked about earlier, just signing that piece of paper. So with Concentric being a digital application, we can move at least some of that process earlier in the treatment journey, and crucially outside of the clinic walls. It's not a piece of paper, so you can provide this to patients digitally. So once a clinician creates an episode for a patient from a template, personalizes it to them, they can discuss it face to face. But there's also the option for this to be shared by email, by SMS to the patient, to allow them to access their information remotely, discuss it with their partner if they want to do so, with their kids, with their friends, or just consider the information in more time. And then they can actually record their treatment decision remotely as well. So they can add an acknowledgement, a signature to their consent info, which is sent back to the hospital so that the hospital or the clinic or the healthcare organization knows that this patient has given their consent and is ready to go ahead with the treatment. So some of the benefits that we know of why bringing this earlier in the patient journey is good. One thing we've spoken about already is the shared decision-making element, but there's also the on the day of treatment impact of this as well. So when consent discussions and the consent process takes place on the day, it leads to treatment delays, cancellations in some cases because you're having these rushed conversations. There are forms that can't be found because they're on a piece of paper, and they, as anyone who works in a hospital or has ever worked in a hospital will know, that pieces of paper grow legs and disappear. And so because this is digital, it can be done ahead of time. So you don't have any of those knock-on things, or you have much less on the day. So some work by Imperial College in the UK showing that this reduces day of treatment delays and cancellations by kind of 5 to 10%, which is quite major in terms of the impact that has on patients, in terms of the clinical outcomes of the hospital, but also in terms of the cost of treatment, because you're not having patients show up, clinicians standing about waiting for things to happen, and you can kind of get things going on the day of treatment.
I was thinking about from the business point of view, from a hospital side, where those benefits would really come through onto, I guess, the P&L. But that's a really good example of that, to be able to get that process down in the front end, because I mean we talk about it all the time in any healthcare setting. The admin burden can have huge implications, and that's not just necessarily people plugging in information into fields. It's all of the bits in between parts where it's like that we can't do this because we don't have this, and the going back and getting something that you already had but it's not here because it's physically in another, all those things that are just hard to quantify. But
one of
um
the one of the scary things that, or not scary, but kind of mind-blowing things that we've seen whenever we've looked at the business case and the economic case for the introduction of a digital consent product versus the status quo, which in the vast majority of cases is a paper process for this, is with the elimination of paper, there are so many costs that go into having a paper process in a hospital, in terms of printing, storing, scanning, in lots of cases, reprinting, signing, rescan. There are so many costs that go into having a piece of paper, and we always try and encourage people to think not of just the piece of paper, but all the things that go around that, as well as the environmental impact of paper for this process. And so there are, I've spoken to clinicians in Australia who have told me the number of times that they have to access, or the piece of paper, the consent form has to be basically touched on the day of treatment, because it's when the patient checks in, it's when the patient is going down to theatre, it's when the patient is in the anaesthetic bay, or and then in the actual theatre itself. And they've told me that it can be up to kind of 8, 9, 10, 11, 12 times that this piece of paper needs to be located. If that's digital, it's in one place. No one needs to worry about where it is, because everyone knows exactly where it is, without having to hunt around for it.
Yeah, I love that. I mean, the cost of a piece of paper in a hospital is not the cost to get the single bit of paper and the small amount of ink on it. It's so much for every time it's used. There's like 30 minutes burnt of someone's time in doing stuff that probably didn't need to happen. That's super interesting to think about. You touched on too that a well-established product in the UK, Concentric, and that's pretty comprehensive in terms of, I think you said 2,500 or 3,000 templates of different I guess modalities or areas of healthcare that is services. Walk me through and tell me about some of the most common customers or use cases of Concentric in the UK.
Yeah, sure. So at the top level, Concentric is used by 1.3-ish million, so over 1.3 million patients a year in the UK. So Concentric is being used by 10,000 clinicians on a weekly basis. And in the vast majority of those cases, for those clinicians, it's the only access that they have to consent. So they're not also using a paper consent process. This is purely using Concentric for that. So Within the UK, Concentric is used in 30 plus NHS organisations, so used right across the board for all of their specialties, both medical and surgical. It's also used in private healthcare organisations as well, in terms of replacing their consent process too, used within Circle Health Group, which is the biggest UK private healthcare group across all of their hospitals. So it's very well established there. Recognizing that there are some differences between the way the healthcare system is set up in the UK versus Australia and New Zealand, we are likely to see that whenever Concentric comes to be used here more in a more widespread way, we will see that how it is used is probably a little bit different because there are differences in terms of how the healthcare organisations are set up. But certainly in the UK, it's large healthcare organisations using it basically in place of their paper consent process, to the point that they basically don't have any more paper consent forms left within the hospitals. It's totally replacing that.
Yeah, very cool. Hey, you touched on, the changes required to then adapt to the Australian New Zealand healthcare system. Often people look, and right to say so. Often there's similarities between the UK and Australia, and there's a good crossover there. But there's obvious nuances, and I think it's a 1.2 or 3 million patients and 10,000 or so clinicians. There's many more patients and clinicians in the UK. Why look to Australia and New Zealand for expansion?
Yeah, so I think there are a few reasons for that. So, one of which is that the healthcare organisations, while there are some differences, are quite similar in terms of the model of healthcare, in terms of who patients go and see, how they go through, and there's a predominantly public-facing hospital that people can go to, and so there are lots of similarities. We see lots of doctors moving and nurses and all healthcare professionals moving from the UK. From the UK to Australia. We see some moving from Australia to the UK, but definitely currently it's much more moving from the UK to the southern hemisphere. And so we're seeing that there is lots of cultural similarities in terms of how the healthcare setups are because of the movement of clinicians between the two. One of the reasons that we've chosen this as a place to try and grow the use of digital consent is because the current consent process here is exactly where the UK was 5-6 years ago, before Concentric and before digital consent really started to become implemented across the health service in the UK. So we recognise that there is an opportunity here for us to improve the consent process within Australia and New Zealand, because so many hospitals and healthcare organisations are still using the analogue, out-of-date paper process, and so we recognise that there's an improvement that we can make here.
Super cool, and yeah, that's a good point actually. There's in terms of getting those champion end users and all of that. If we are receiving a lot of clinicians from the UK into Australia, that makes sense, because they're quite familiar with it. Hey, something I was thinking too is that we've spent a fair bit of time thinking about the benefits around shared decision making and the economic and all of that, and right down to reducing delays and improving patient experience and the role that consent plays in that. I guess the most obvious reason why consent's such a important thing to focus on, either for clinicians or for the businesses that support them, is around the medico-legal perspective as well. So I'm going to guess this is not on par, but provides a better kind of reassurance and management around risk, and I expect you've probably thought about it a lot more than I have. Walk me through the benefits around that side too.
Yeah, sure. So, yeah, when it comes to consent, one of the main implications of consent and a good consent process is the medical legal side of things. And so there is a tendency towards people thinking about that potentially in a kind of defensive way of what we want clinicians to do is to provide patients with like every possible risk of their surgery. So if something goes wrong, then they can say, ha, I told you so. That's definitely not where we're starting from here. What we're trying to do is to get patients to make better decisions and to provide them with, use Concentric to facilitate the provision of better information so they make better decisions, so that there is a reduced likelihood really of a bad outcome for the patient. So we know that in a traditional paper world, the majority of consent forms contain errors. There are often risks left off because people are starting from scratch whenever they're providing the information for the patient. So they are writing on a piece of paper, often from memory, all of the potential risks of a surgery, which is not a great process. And you'll remember earlier I spoke about 10 clinicians for one patient. They may all provide different info or vastly different information for that patient. So with the use of Concentric, because it's using these standardized templates that are then personalized to the patient, what clinicians are able to do is to provide more information for the patient tailored to them. And therefore, it means that there is a reduced likelihood that they are essentially going to fall victim to a failure to warn case, which is where an outcome happens to a patient that they weren't previously told about. Some work by NHS Resolution in the UK is showing that the use of Concentric leads to a 50-ish% reduction in terms of the risk of a failure to warn case versus using paper. So it's a fairly significant reduction. Consent in Australia, the study I was reading at the end of last week in prep for a presentation was showing that 3.5% of medical legal claims in Australia relate to consent-related issues. Really? And so if we're able to have an impact on that, then that's actually a pretty sizable impact that we can have on those cases.
Yeah, 100%. No, when you brought up, the defense side of things, I thought about all those awful examples outside of healthcare of, because someone accepted the terms and conditions of their online subscription, they weren't able to make a claim for a physical visit into something else that was owned into. I'm not going to name specific large organizations in case I get flagged, but it's horrible stories. And I guess the purpose of this is to really provide that clarity and the alignment between patient and the clinician, so that then I guess everyone wins in the end. Better outcomes, more efficient service. That seems really logical to me. And so lastly, Patrick, like you're here in Australia and set up and doing presentations and having conversations. Who's who are you really keen to speak to in this process of, because it sounds like you've got a lot to share around consent and overly nerdy about it, as you say, which is great, because there's probably a lot of people within healthcare at different sizes and stages that probably think, oh, that's kind of relevant to me, but I got a few things to do. Like, at what point should people be reaching out to you, and from what kind of healthcare organizations are really getting benefit from having a chat?
Yeah, totally. So, as you say, I could talk about consent to anyone, and thankfully, after about half an hour, you're still awake. So, hopefully, this isn't, I'm not extremely dry whenever.
Do they need to provide consent to you to be done?
Yeah, warning, after half an hour, you may fall asleep. We're... So, to think about our UK context, as I said, public hospitals, private organisations, as well as individual surgeons and clinics. So we're in Australia, and Concentric's already being used by individual surgeons and clinics. We are looking for larger hospitals, both private and public, who are interested in modernising, digitising their consent process. We want to work with healthcare organisations to learn what that is like in Australia. There will be differences between the process in the UK and Australia. So we want to bring our years of experience of what this process is like, acknowledging that there will be some, as you alluded to earlier, nuance and adaptation required here. So we're looking for pilot sites who are keen to work with us to digitize their consent process, and bring the decision-making experience for patients and clinicians into the 21st century, essentially. So we're looking for individual surgeons, for clinics, for private and public hospitals to use Concentric.
Amazing. Well, look, there'll be the details for Concentric in the show notes of this episode, and of course, as THT Plus company partners across our website, and look forward to sharing some updates with our newsletter subscribers as things happen throughout the year too. And a lot of good conversations in the THT Plus community as well with Patrick as well. I definitely recommend getting in touch to explore more. So Patrick, mate, I really appreciate you making the time to come and have a chat. Thank you so much.
Cool. Thanks so much, Pete. Really appreciate that.
We hope you enjoyed this episode of Talking HealthTech. Make sure you like and subscribe, and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.